Hi, students. Today I'm going to go through questions. This is from Activity 1 through Activity 10. I had probably 5 or 6 students with individual questions on this assignment, and I thought it'd be easier just to do a video because this way maybe some of these questions that you had are answered by other students' questions. So I'm not going to go through every one. I'm going to go through the ones that different students asked me about. I'm going to start off here with code set 1, and I kind of talked about this in class already with number 1. Okay, this one here, remember in class I talked about if we have diarrhea and lower abdominal pain, those are signs and symptoms of the viral gastroenteritis. So with this one, we only code one code. I had a few students ask me how come we're not coding everything. We don't code signs and symptoms once they are integral to a diagnosis. All right, so number 2, everyone did okay with that one. Same thing with number 3. Go to activity 2, neoplasm. These were okay. The biggest thing here is number 2, and I would never ever, with this, you're not um, experienced coders, but I'm just going to explain to you the C80.1. I had a student ask me about that. The primary cancer is unknown. So whenever they do not know where it metastasized from or metastasized to, they throw in a code there so that we know that there was a primary and a secondary. Once again, this isn't something that you will need to know, but I just kind of wanted to explain the rationale. All right, so let's go ahead and move to activity 3. This one went well. I really didn't have any questions on activity 3 with the blood loss. These were pretty self-explanatory. So let's go ahead and go to activity 4. This one here, the E05.10, that one was good. Everyone got that one right. Okay, this one here, we had number 2. We had quite the discussion about this one in class. All right. Keep in mind, I wasn't real happy with what we had here with the hyperthyroidism with, the goiter. So here we have definite diagnosis is the Graves' disease. And I went ahead and told everybody that they could code the E05.90, okay, because it doesn't really state goiter and I don't have enough information there, okay? So any other questions on that one, let me know, but we did go through that one in class. All right, so let's go move on here to activity 5, mental behavioral neurodevelopmental disease. So this one here, this was the emergency room provider did do a drug test. So came back positive. So with this one here, we want to go ahead and it's going to take you to put in abuse, and you can look under marijuana, but it is going to take you to cannabis. So here we have abuse, drug, cannabis. I'm going to click on that. And with that, it's with anxiety disorder. So I need F12.180. All right, I had a few students ask about that one. All right, so let's move on here to the next. Okay, so diseases of the nervous system. This one's a little tricky. I really didn't expect students to get these all wrong. All right, I'm sorry. Okay, so we have I63511, I69.351, and then I69.320. I had one student ask about the health history on these, and with that, you don't. We're just going to go right under disease because these kind of are late effect codes. So this is super hard to code, but I'm going to just kind of run through it. Okay, so on code set number 1, one thing with this activity, like I said, this is hard. I didn't expect students to get this right. But the I6.3.511, that is fairly easy. You just go under right here, infarct. And to be honest, this is what's happening right now. The I6.3.5 is happening right now. Okay, as you can see here, the patient has a history of CVA and with right-sided hemiplegia and aphasia. So what we want to do, we want to go under sequela. All right, if you go under history of, you're not going to find the code that you want because these are going to be Z codes. Sequela means that it's a late effect, that they're still having issues with their hemiplegia and then aphasia. They're having trouble talking. They're having, again, left or right side hemiplegia. So a little paralysis going on. So that's why we want to go with sequela. And if you go disease, if you can see here, we go to cerebrovascular. We want to go to codes aphasia. And then we want to go ahead and code hemiplegia. Okay. So that one can be kind of confusing. And as I stated, I don't expect medical assistants to get that correct. Okay, I'm going to go ahead. If anybody else has any more questions on those CVAs, let me know. With that, like I said, with that, it's the history of. You're not going to go there. That's something that's in the past where when somebody has a cerebrovascular disease, those signs and symptoms or the whatever's wrong with that patient's still there and they're still struggling with it. Okay, activity 7 here, really no issues here. The biggest thing I want students to remember is to always look for that 7th character. Okay, I am going to run through that real quick. This one can be tricky with this type of book. Once again, I can see why some had it incorrect. But what they're telling you here, you go to H5 4.7, which H54 has a note in the definition of visual impairment. Category 2 is considered low vision. So at that point, you want to go ahead and look for the codes. And then you want to go to the left eye, H54.52. So if I look here, one thing you need to do is when you want to go down to the A, and then you're going to click on that. Oh, I'm sorry, more specific code. If you go down here, it gives you the nice chart. So if I go to 542, and then we go to 52A, and then you want to go to category, that'll be category 2. That's going to be our 7th character. All right, so let's go ahead and activity 8, circulatory system. With that one, this could be tricky. Set 1, I2 1.9, everyone did okay. I think we went through that one in class. Number 2, we do have 2 codes for number 2. We did go through this one in class also for those there, and you need both of them. So I am going to move on to activity 9, the respiratory. Okay, so let's go ahead and look here for number 1. This was fine. Number 2, we have pneumonia. And we also have the Z8614 with the MRSA. And with that, I did have one student search of history of. This one here, we do want to go to history of. I just want to state that history of MRSA, once again, you go to history of, okay? With CVAs, those are a different thing because those are more late effects. Okay, keep in mind, CVAs are late effects. So that's why we're looking in a different area. I did have one student ask about that. And then activity 10, our last one, go down to that. We have blood in the stool. This one was fine, okay? With this one, I had a student once again ask me, how come we're not coding blood in the stool? Because blood in the stool is going to happen because you have internal hemorrhoids, all right? So we're only going to code the internal hemorrhoids. We do not code the blood in the stool. Number two, with this one, I question on this one here too. Mr. Vostra in the surgical suite today to have an incarcerated hernia of his belly button repaired. What is the ICD-10 code reported? So you're going to look under hernia, acquired, umbilical with obstruction. Okay, you're right. The problem says nothing with obstruction. All right, keep in mind if it's incarcerated, and I know this is, basically that is telling you it's obstructed. So it's one of those things that you're going to learn on the job. All right, and number three, we did go through this one in class. So this was kind of tricky, and it gives you a good pathway here. So any other questions from this assignment, please reach out to me. If there was one that I missed that somebody sent me, I will be happy to talk about it or write you an email. Have a great rest of your week.